Before I start my presentation, I would like to ask you a question. How many of you doesn't have a Facebook account? Okay, good.
But then you don't use it.
Okay. What about Telegram? Telegram. Okay. Line. Line. Instagram. Imo. WhatsApp. WhatsApp. All of you. Okay. Okay. The reason I thought about this presentation is about a proposal to study a certain phenomena. The idea came from, I was an event, and then a lady approached me, she knows me, and she said, we have a weight loss WhatsApp group. And we are people who know each other, relatives, friends, and we are overweight. We decided to lose weight. And we created this group. And the group was running on for like 3-4 months. And she asked me if I can join the group to observe the information that they are exchanging with each other. Now, I said yes, and then I told her, just give me time to observe, like 1 month before I decide to join and to observe what you are saying and to give an advice. And then I started to search in the literature. I didn't find any support groups created by the public that didn't include any professionals, and there was published data about it. Most of the Facebook groups or other types of chatting rooms are, especially for people with chronic diseases and health problems, are supervised or created by health professionals. So I decided to do a study, and I designed this proposal to explore a cross-platform mobile messaging application, which is the WhatsApp, and it is used by a self-created weight loss group. And as I said, the usage of the cross-platform mobile messaging applications is popular in exchanging information, including health and weight-related messages. And because I live in Saudi Arabia, most of the members of the group, they live in Saudi Arabia, but some of them are outside. And so they are diasporic, but still they exchange the information and their feelings also in that group. A little bit history or a little bit information about the status of obesity in Saudi Arabia. In 2013, the Saudi Health Information Survey reflected that 28.7% of the population are obese, and this is the survey was done among more than 10,000 adults above the age of 15. 51% of the participants.
Is this both sexes or just
yeah,
female?
this is all. 51% of the participants were female. Out of this, 50% of the participants, which almost more than 5,000, 33.5 or almost around 34% were obese. Now, among women, obesity was associated with marital status, education, history of chronic conditions, and hypertension. Now, in Saudi Arabia, in the 1970s, due to the increase in the income because of the discovery of oil, people started to rely more on spending on their food intake, and of course, fast food restaurants, consumption of fast food and fatty food items were also increasing. And housewives or females in general started to depend on housemaids. So there is a low rate of physical activity and bad eating habits. And this has contributed to the increasing levels of obesity among them. Many studies were done, and in one of the recent studies in 2014, it was found that it's not the lack of knowledge or the lack of social support that will make them obese. It's the lack of facilities, that there are not enough facilities that will help them to lose weight. And in 2013, Ministry of Health started a program to fight obesity, and to treat also obesity with all the levels of morbid obesity. And because the program is relatively new, still we don't have data or results from that program. There are documented weight loss barriers, psychological barriers like dieting, exercise-related emotions, lack of willpower, perceived lack of support, lack of motivation, some of lifestyle barriers like demands related to family commitments, social life, and work. These reasons will make it difficult for them to adhere to the diet or exercise. Now, in spite of the socio-economic state transition in Saudi Arabia, it's still difficult for some women to access weight reduction facilities, as I said earlier. As I said, it was observed that many women started to formulate these groups, virtual groups, started to support each other, suggesting diets and physical activity programs. And the content and quality of these informations and its impact, in addition to the experience of those women, are poorly understood because we don't have studies about it. Furthermore, qualitative studies conducted among overweight and obese Arab females in the region are limited. And based on the literature review, this study will be the first to explore a virtual community of practice group that was not designed or established by healthcare providers. Now, so therefore, this study is meant to answer the following question. What are the experiences of overweight and obese women with being overweight, obese, and having to adhere to weight loss regimens as expressed by them in virtual support group conversations? Now, the objective of the study is to analyze the conversations exchanged between the members of the group, to describe all the information shared about the group members, their experiences of being overweight, having to lose weight, as well as weight reduction measures. Now, specific objectives to describe the information related to being overweight or obese, to explore the experiences of the group members, and secondary objectives maybe we will assess the quality of the information shared by the group members and exploring why participants joined and took part in the virtual weight support group. And now the study area, of course, it's non-conventional, non-traditional, or the setting is non-traditional setting. It's a cross-platform mobile messaging application, and it's online. Subjects are members of the community of practice group who are trying to lose weight and created this group in a cross-platform messaging application. All of them are women, and they decided to exchange information about weight loss. The design is qualitative, exploratory design, evaluating one platform and its content. Data will be abstracted and coded. The sample size, a convenient sample of at least 15 participants. In qualitative studies, we don't decide about the sample size beforehand. It's just when you feel like you are reaching the saturation of the data, and minimum I think is 80. Sampling technique, a virtual support group consists, as I said, of 15 members and their conversations of those members who are willing to participate. Maybe the group will contain more than 15, so the ones who are willing to participate, their data will be recorded and analyzed. Now, the analysis of the self-report narrative on the internet conversations or online conversations will be collected and analyzed. Questioning will be based on the concepts which emerge from the initial analysis. Unstructured observational guide will be used. Probing questions whenever we need will be directed at exploring the concepts which emerge from the responses of the participants. Regarding the data management analysis plan and analysis plan, conversations will be translated from Arabic to English because all of them are Arabic speakers. Conversations will then be coded and categorized into sub-themes, and then further analysis will be done and synthesis will occur to identify the theme inherent in the conversations, after which a core theme that represents the entire data will be identified. Now, an expert in health qualitative studies will be involved. I'm relatively new to the qualitative studies, so I need an expert to help in coding and categorizing the information. Data will be analyzed independently, then evaluated until saturation and emerging themes are appearing. Now, informed consent, this is a virtual group. So we will ask them about their consent online, and then once they say they accept, we consider them part of the study sample. Data of group members who will not participate will be omitted. Confidentiality will be considered, and data will be protected and then destroyed upon the completion of the study. Pseudonames will be given to the participants. And the scientific integrity will be considered. Authenticity in data is a major concern in studies using online conversations. Now, it will be ensured by initially analyzing existing conversations, since participants will not be influenced by the knowledge that the research will be done while they are engaged in the online conversation. So they will not know that I'm part of the group till the end of the study, and then we ask them for the permission. Access to and the use of the data is dependent on the informed consent, as explained. Now, academic rigor is also very important, and all the 4 parts of the academic rigor will be considered. Data will be collected over a period of required time to reach the saturation that is needed. Data triangulation will be applied. Experts will be involved to assure that the data is valid. The double checking of coding and categorization also will be done by the researcher and the expert who will be involved. Maybe we will involve a co-researcher also. Transferability, adequate concentrated description of the investigated phenomena will be available to help in gaining proper understanding of it. This will allow for comparability between this study and any similar studies or similar situations. In-depth description of the research methodology will be also there. Regarding the mentability, describing the methodology in details will enable others to replicate the study. In the part of confirmability, bias will be avoided by clearly stating the principal researchers' beliefs and expectations, and ensuring that this does not influence interpretation. Now, in addition, the study's limitations and their effect will be also acknowledged. Detailed methodological description will be also recorded or will be there, documented. Since the participants, the principal researcher is an expert in nutrition, some of the themes were expected to emerge, including trial and effectiveness of different weight loss diets, including fat diets, suitable types of physical activity, social and psychological related difficulties, sense of social support and belonging. Even though the above listed themes are identified by the researcher will remain true to the data obtained from this specific study by using the process of bracketing to avoid any kind of bias within the context of the study. And this is the schedule for the work plan. Of course, we need to submit the proposal for the research committee in our institution, and these are probably it will need around 8 months to finish the whole thing. At this stage, we already have the literature review and draft of the proposal. And thank you for listening.
Thank you.